So let's, guys, read this one and let's talk through this one briefly. I'll read it out loud. Callie responds to a weekend message through the healthcare worker outreach. When you call, she has just returned from another 12-hour shift. Callie sounds depleted emotionally. She and her husband live in Irvine. He still has a job and is working from home. They have 2 children, ages 3 and 7. Callie and Paul are doing okay financially. However, as you get into their conversation with Callie, you hear that she is overwhelmed with all the suffering in her job. She reports feeling guilty that her family is safe and well. The people she serves in LA County are far from safe and well. The other day, she finished a shift and zoned out in the parking lot of her clinic where she works. She says to you, "I don't know what happened. I was exhausted. I sat in my car and it was so quiet. I just stared out the window. The next thing I remember, the security guard knocked on my window to see if I was okay. I'd been there about 30 minutes. Okay, so here we have someone who's emotionally spent and is trying to cope. And the way she coped was, hey, let's just sit in silence. But then her mind and her body kind of just shut down for a pretty extended period of time, and she lost that time. And this is sometimes a response to an acute response to stress. It's kind of like our fight or flight system is on. We're coping. You know, she's at her job. She's moving. She's, you know, muscle memory is taking you through her work. She's on adrenaline, and then she gets out of that rush, and she sits down, and her body just freezes. It shuts down. So that's a pretty distinct nervous system response. Now, she's not that way on the phone, right? So she's telling you about something that happened in the past. Give me a sense of what level of crisis. Is she in crisis? Is she not in crisis as you're talking to her on the phone here? What are your thoughts, guys?
Well, my first thing I'm wondering is like, okay, well, what exactly are you asking me for?
Mhm.
So I mean, I'm here to pray with her. So I'm wondering how
Mhm.
to get that out of her at this point. Like, what exactly would you like me to pray with you about?
Yeah. Um, so now remember, so this is someone that who's on our healthcare responder list. So we're reaching out to her and we're saying, "Hey, are you okay?" That's the context. Sorry, I didn't get that. That's the outreach, the healthcare worker outreach. Is there are people in our congregation who we are moving toward 65 plus healthcare, and actually over, you know, the reason we're doing this training and sort of bolstering our resources, that we will be moving toward more people initiating contact over the phone through virtual settings over the next few weeks. So these are cases that we're going to run into where we just stumble upon them, and so that's one of these cases. And what we stumble upon is someone who, in the moment, maybe doesn't feel like they're in crisis, but they're telling you stories where their body is definitely in crisis mode. But because of the way that she's trained and wired, she's coping, but her body is keeping a score, and the coping works for while she's, you know, in action. But then you can see there's moments where it's not working. So this is the case where that prayer is, because it doesn't necessarily present as crisis on the phone, because in the moment, but you can hear in the background, okay, there's something else here. There's additional support that we're probably going to need to pull in, because what I'm hearing is, to at one point they were in crisis. Like, you know, if you were with her when she walked out of work, and maybe could be with her as she got in the car and looked over, and you see, oh my gosh, she just shut down or zoned out, and I lost her there. You would see, okay, she's in crisis in this moment, and we would act. So if we hear stories like this, or we hear times where people are not coping well, and at the moment we talk to them, they are, but we know, okay, there's something in the background here that needs to be addressed, because a crisis is very much situational, and we can move in and out of it. So we need to be paying attention to when we hear it in the background. And so here we would want to talk about helping her we would then do questions about, okay, well, what are some ways that we can support you, or some supports that you can have, because you want to help her understand that that there are other ways that she can find support, and that we want to do that, and just to begin to problem solve, or at least think about through questions how we can do that.
Yeah, I'd want to make sure that she ask her if she has community and who else does she have somebody that works with her, and are you sharing, and do you have somebody that is in that same situation that can relate and be there for her also.
That's true, because you want to see, okay, what does she have around her, right? So you're helping her access what's around her. Okay, Brad, you look like you had something you wanted to add there. Did I read that? I'm trying to read your.
I appreciated you redirecting me, because I kind of I didn't realize that in the first part of it, and you really added a lot of good insight to that. So as we're calling people, I do encounter people like this where I've called them and I'm not quite sure what they need yet, and so to kind of just listen to them and figure out exactly where it is that we could pray for them, and get some perspective. I thought that was good. So
yeah. Okay, so there we have two cases. One, we're in a phone call where someone is in crisis, and we need to work with that emotional field of experience right there on the phone. And then there's another case here where we can hear it in the background at another time and place, but we want to be sensitive to how can we come alongside someone who is moving into this kind of reality, but may need help with reaching out. And so we just want to pose the questions, offer it. Now, again, we're not trying to fix Callie. We're not trying to fix the way that she takes care of herself as a healthcare worker. We're just simply saying, how can we want to be poised to help and walk alongside you. And we do that empathetically and using the skills that we're learning here.